Hello, everyone, and thank you for having me come to your symposium today. I'm going to be talking about the mental health impacts of acute cardiac events, including SCAD and other types of cardiac events. My name's Barb Murphy, and I've been working at the Australian Centre for Heart Health for about 25 years in the area of post cardiac event mental health. So, what I'm going to be talking today about is really three areas. So, first, I'm going to talk about the cardiac blues, which is a generic type of mental health impact that relates to all types of cardiac events. And it's an area we've been working in for about the last 10 years. Then I'm going to move on and talk specifically about post-event anxiety and depression, an area I've been working in for a long time too. And then more recently, I've moved into the area of working in mental health research after SCAD, spontaneous coronary artery dissection. And there's a lot of implications for the SCAD work in terms of the aortic dissection impacts as well. So I'll try and link the two there, the impacts for SCAD and AD in together as I go. So first, I want to talk about the cardiac blues. So the cardiac blues is a term we really coined here at the Australian Centre for Heart Health back in 2015. We'd started to see that a lot of patients after a heart event, including acute myocardial infarction, heart attack, bypass surgery, AF, atrial fibrillation, and other acute events or a diagnosis, went on a roller coaster of emotions. It was a big shock to people. But we know, and there was a lot of emotions that went on, but we noticed that if given time, people tended to recover. So we started to talk about the cardiac blues being a fairly normal part of having a cardiac event. What we saw was people would come home from hospital and they'd received fabulous treatment physically, but they hadn't had a lot of attention paid to the emotional side of things. So sometimes they'd say, I was recovered physically, but my mental health was worse than it had been before. With the cardiac blues, we talk about there being three sets of symptoms: emotional symptoms, behavioural symptoms, and cognitive symptoms that we class as this cardiac blues. Keep in mind when I'm talking about the cardiac blues, we don't think this is a problem. We just think this is a normal part of the cardiac event. So we developed up resources for cardiac patients, and that's what's sitting here behind me is part of our pamphlet or brochure that we develop for patients. So we talk about the emotional side and the behavioural cognitive side. So in the emotions, we started to see that people were feeling this whole raft of emotions. So firstly, we had shock. Most people said they had no idea it was going to happen and they couldn't believe it. There was a lot of denial as well for people. Sometimes people found it really hard to accept that they'd had a cardiac event, especially if they were a bit younger and they weren't expecting it. Then for most people, we saw loads of worry. So this is the anxiety type of things. So worry about never getting back to your old self, and worry about having maybe another event, and worry about death as well. Some people talk to us about having feelings of guilt, like I should have looked after myself better, and things like feeling guilty about the impact that the heart event had had on other members of their family and their loved ones or their work colleagues as well. Some people were experiencing anger and irritability, and they didn't like this. They'd never had these feelings before, so getting frustrated and irritated. Lots of sadness as well. We're feeling down in the dumps, feeling blue, feeling low, teariness. And some people also talked about the positive side, where they felt a sense of relief at having had a diagnosis maybe. Along with these feelings and emotions, there's also these behaviours. So we see people withdrawing from their usual activities, not wanting to do their normal things, withdrawing from other people, getting tearful and crying easily, and this irritability and short-temperedness. So they're the sort of behavioural things we see there, as well as sleep problems, changes in appetite, changes in sex drive. So just life getting all disrupted and being out of the norm. And then when we see these cognitive sides, these are the sort of mental thinking sides, we see confusion and forgetfulness, this inability to concentrate. So people talk a lot about They can't, like, maybe watch the television, can't watch a whole movie, can't concentrate on the newspaper or on reading a book. And then we see lots of stuff around bad dreams, nightmares, and then worry about having another event and thoughts about death. So these are all the cognitive side of things. But with the cardiac blues, we know that almost everyone is going to go and experience to some extent the cardiac blues. And then we know that it can happen to anyone. You don't have to have had anxiety or depression in the past for this to happen. So it's a pretty common thing. And we know that patients have told us they want to know about the cardiac blues. Many of them told us back in 2014 that hardly anyone talked about the mental side of things to them. They'd leave hospital, no one would have mentioned it. We interviewed patients about 6 months down the track and they all said no one had mentioned it and they wanted to know. We published this paper for physicians and cardiologists to try and say, look, people want to know about this emotional side of things. Please talk about it to them. We also know that the cardiac blues is normal. It's like a grief or emotional adjustment phase. It's where people are coming to terms with their event. And it usually resolves for people in about the first 3 to 6 months after the event. And it doesn't indicate that there's a problem. But not everyone recovers. If people are supported, the cardiac blues should pass and people just come to terms with it. But for many people, the cardiac blues can go on and develop into more serious anxiety and depression. And this is what we're concerned about. So I'll move now on and talk about the anxiety and depression. So with our patients, we try to differentiate between the cardiac blues, which will resolve, and anxiety or depression, which will persist or maybe even worsen. And that's the problem area. So I'm going to talk now briefly about that. In our studies of anxiety and depression, we find that after the 6 months mark, about nearly a third of people are anxious, have severe anxiety, about 15% are depressed, and that makes about 1 in 3 patients, 31%, have either anxiety or depression. This was a large study we did with 900 cardiac patients post-event AMI, bypass surgery, and so on. Anxiety and depression are associated with what we call red flags. So if you've had a post-event mental health problem prior to your cardiac event, you're more likely to develop anxiety or depression after your event. Similarly, if you're younger, that's usually about under 55 for the average cardiac patient. If you're socially isolated, that will increase your risk of anxiety or depression or mental health problems. If you're experiencing financial strain, that's also an indicator. Also, if you're a smoker, it's more likely to indicate that you might have anxiety and depression. Also, other factors like being obese or having diabetes indicate an increased risk. And of course, if you've had a recent loss, like loss of a partner, a death in the family, or a loss of a job, we call that compounded grief, where there's 2 events happening at once. We know all these factors increase your risk of a post-event anxiety or depression. We also know that these all add together. These risk factors are cumulative. So the more of these that you have, the higher your risk of anxiety or depression. So you can see on this slide here, once you're younger, plus you've got a history of depression, plus you're unpartnered, your risk of anxiety and depression goes up to 85%. So that's a problem. Post-event anxiety or depression is related to things that are not so good. So having anxiety or depression after a heart event is associated with poorer lifestyle. So a poorer diet, lower physical activity, more likely to smoke, lower social support, isolation, and non-attendance cardiac rehab. And these are things that will compromise your recovery. These anxiety and depression and mental health problems are also associated with higher morbidity, like readmission to hospital and re-events. And unfortunately, we also see that these things are associated with premature mortality. And this just highlights to us why it's so important that us as clinicians identify people who are at risk of developing anxiety and depression. We need to find these people early on. And if you're a person who's had a cardiac event, you need to keep a mindful eye on your mental health, because if you do develop anxiety or depression after a heart event, we need to help you get on top of that and seek treatment so that you'll reduce the risk of all these things happening. So that's why it's important. And we can use those red flags, those things that I mentioned earlier, pre-event mental health problems, the social isolation, etc., to help identify people who might be at risk so that we can help them. I'm now going to go on and talk about our work with SCAD, and we've done loads of studies in the mental health impacts of SCAD in the last couple of years. As you know, SCAD is an increasingly recognised cause of acute myocardial infarction or heart attack in younger women. I know this is a bit different than the profile in aortic dissection, but in coronary artery dissection it tends to affect younger women, and usually pretty healthy women with few classic risk factors, and mostly people who don't have atherosclerosis. And it occurs when the hematoma develops within the artery wall, and there's a tear, usually, which obstructs blood flow and causes the heart attack. It's common in people with underlying systemic vascular conditions, as is aortic dissection, and physical exertion's a trigger. So you can see there's some similarities with aortic dissection as well. SCAD is considered a traumatic cardiac event, and it's because it occurs out of the blue. It's kind of rare, people don't expect it. It's often poorly managed, which makes it really difficult for people. And its management does differ from traditional heart attack. There's loads of confusion about whether people should be exercising or not, and this causes enormous stress for people, particularly when a lot of people who have SCAD and aortic dissection have been really physically active people, sometimes elite athletes. So that makes this whole issue of exercise really confusing. And it's thought to have a relatively high recurrence rate, although that is getting better understood now, and we're seeing maybe it's not as high as we previously thought. We've done 4 studies in the mental health impacts of SCAD, and I'm going to talk to you about each of them. The first was a comparative study looking at rates of anxiety or depression after traditional SCAD, traditional heart attack, and SCAD heart attack. So I'm going to show you that. And then we went on and did these focus groups with SCAD survivors to look at their psychosocial impacts of SCAD. From there, we did an online survey looking at the prevalence of mental health impacts. Then we did this new study on post-traumatic growth after SCAD, and I'll talk to you about that. And then we've developed an online support program for SCAD patients. So I'm going to talk to you about each of these just briefly. This is our first one. So in each case, I've got a little infographic here that talks to you briefly about the method we use and the results we found. So for this one, we had a study of 186 heart attack patients. 39 of them were SCAD heart attack and 147 of them were regular heart attack. And what we wanted to do, they did an online survey. This was part of a larger study. So we just happened to have this info when we started our SCAD work. And we happened to have these 39 SCAD AMIs in our AMI sample. So we compared rates of anxiety, depression, distress, and cardiac distress in these patients. We had a questionnaire for each of those measures for anxiety, depression, distress, and cardiac distress. In the green bar here, you can see for all of those measures, anxiety, depression, distress, and cardiac distress, they were 3 to 4 times higher in our SCAD people than in our general heart attack people. So this was very concerning for us. We thought, wow, the rates of these things are already high after heart attack, but they're even higher after SCAD. So we published that paper. That was our first publication in this area. Then we thought, all right, we need to talk to SCAD survivors about what actually has happened after they've had their SCAD. How have they been feeling? We're really fortunate to work with a great group here in Australia. They're in Sydney, called the Victor Chang Cardiac Research Institute. They've got a database now of almost 500 people who have had a SCAD, and they're looking at the genetics of that. They've got 500 people who have enrolled for the genetics study to see what genes might be involved in SCAD. So we work with the Victor Chang group, our colleagues there, and we sort of tag on and do mental health studies with that cohort of patients. So we decided, all right, we'll talk to some of these people about what they experienced. We had 30 people, and they were participated in one of 7 online focus groups, which I facilitated with my colleague, Michelle Rogerson. We talked about all sorts of things about what happened for them after SCAD. As you can see, these are the types of things they talked about. They felt uncertain. They were in shock. They felt helpless about how to manage it. They had a fear of the future, fear of recurrence, and fear of death. They felt confused. They had a sense of loss of control. They thought it was unfair. They'd been looking after themselves. They felt isolated and lonely. They have felt vulnerable. There was a loss of autonomy and control over their lives. They felt sad. They felt frustrated how to manage it. They felt depressed. They felt burdened about all their family responsibility. Remember, as you know, many of these are just youngish to mid-age women and a small proportion of men who have lots of family responsibility and mostly worked. So we found that there was all these experiences they had. From there, we thought, right, we need to do a survey. Oh, these are some of the things they said. So in terms of emotional impacts, you're all over the shop emotionally and mentally. Your moods are all over the place. It was so random. It was out of the blue. It's pretty teary. I was pretty teary. It's hard to stay positive. It's isolating. They felt like life is pretty fragile. So these are all the things people told us. The life I had before no longer exists. It's a new life now. They felt a loss of control over simple things like where you go, what you do. Have to rely on other people for the most basic things. Family-wise, I'm frustrated. I'm tired all the time. I can't do what I did before, and I can't do the work I used to do. Loads of uncertainty. What's going to happen? What should happen? What shouldn't happen? What is and isn't the treatment? The uncertainty, not knowing. Many people talked about that being the worst thing. And will it happen again? It's always hanging over your head. And loads of people talked about this lack of information from health professionals because many health professionals don't know enough about this condition yet. From here, we did an online survey with our people involved in the genetic study. We developed up items to address all the things that we'd been told in our focus groups. And if you look at these graphs, these were the most prevalent emotional impacts that people said. Over 80% shock about having had the heart attack, and over 80% worry about having another one, which was very concerning. Concerns about triggering SCAD were really common, and that was related to exercise and stress. Worried about, concerned about uncertainty about how much exercise they should do and safe levels. And this overly awareness of their body and bodily sensations and being overly focused on that. Look at the impacts on people's favourite exercise. Around 45% of people saying they'd stopped exercising. And as I said, these were really physically active people. And loads of impacts on work as well. Anxiety and depression, we found they were slightly less common in this cohort than we thought. 21% met the criteria for anxiety and 21% for depression, and similar risk factors or red flags for those who were more at risk. We think these rates were a bit lower than we expected because our SCAD survivors in this sample some of them were over 5 years since they'd had their SCAD, but still very concerning levels and way higher than the general community. Then we did this study around post-traumatic growth, and this was really exciting. We found that, yes, it is a traumatic event, this SCAD, but it can also have a positive side. With trauma, we get post-traumatic stress disorder, but we also get post-traumatic growth. We did focus groups. They were the same focus groups. And then in the survey, we also asked about post-traumatic growth in the survey. In terms of the themes that came out in our focus groups, people talked about this appreciation of life and living in the moment, this sense of personal agency and getting a sense of being stronger and being able to focus on looking after themselves, setting boundaries as well around what was important to them. I'm going to focus more on my family and myself and not worry about work so much. And also some people talked about embracing life and experiencing life to the full, and maybe doing some things that were involved risk taking that made them feel really excited about life. A lot of people talked about a new work-life balance and gaining spiritual clarity. In the survey, we found 80% of people experienced some degree of post-traumatic growth after their SCAD, which was fabulous. And it was higher if people had more social support, if they were a bit younger, if they weren't depressed, and if they had a little bit longer time since their SCAD. We've also developed a support group for SCAD patients, and it's based on acceptance and commitment therapy. And we're currently analysing the results from that. We've had 30 people participate in the program in groups, and it's just been fabulous. So we'll hope to report on that really soon. This is a bit of a summary of what I've told you about SCAD, and I want to say that all these things really relate to aortic dissection as well. Personally, I haven't done any work in the area of aortic dissection, but the Aortic Dissection Collaborative Group have, and I've looked into the work that they've done. This was a group that was established in 2019, and they have identified mental health as a priority area for supporting people after aortic dissection. And just like in other cardiac areas, AD patients tell us that they want a focus on mental health after their event. So the AD Collaborative established a mental health working group who went on to do a review of the work that's been undertaken in this area. And I'll just quickly run through what they've found. You can see it's very similar to what we've found in SCAD. So most research has focused on quality of life, and there's definitely negative impacts on quality of life after AD, but they do improve over time, just like our cardiac blues. There's growing evidence for post-traumatic stress disorder after AD, and AD, like SCAD, is classified as a medical trauma. It's due to the sudden onset and the uncertain trajectory. There's some new studies coming out around anxiety and depression after AD, and similar to SCAD, the other areas are so similar. It's amazing. Uncertainty, fear of exercise, worry about death, loss of freedom and control, and impacts on one's self-identity, hypervigilance about symptoms in the body, loss of trust in the body, worry and concerns about the future, and exhaustion and fatigue. They're really so similar. And the working group's going to be undertaking more research in this area of mental health post-SCAD. So watch this space, and we might hope to do some work in this area in Australia as well in the future. Another area we work on is getting back on track after a cardiac event, and we use this EASE model. We want people to have both enjoyment and achievement in their life. So we try to encourage people to get both types of activities into their daily life. The other key things are social connections, sleep, getting your sleep right, and getting the right level of exercise and nutrition in your life after your cardiac event. I can't talk a lot about that now, but they're the things that we focus on. So just in summary, this is what I've talked to you today about, most importantly, those mental health impacts after SCAD and AD. And there's more and more focus going on in this area, and I'm really grateful that I've been working in this area. It's such an important area, and a really important area for us to continue to work in. Just to acknowledge all my colleagues from Australia at the Australian Centre for Heart Health, Victor Chang, SCAD Research Inc., the University of Sydney and Westmead Hospital, and the National Heart Foundation of Australia for supporting our work in this area. Thank you, everyone. I'm really grateful that you've had me come and talk with you today. Bye.